Mr. President, you're seeing that too, where the critical needs hospitals, the critical access hospitals, the only hospital available, are often also hospitals that disproportionately have people that are not insured or people that are of low income that aren't on any government program. And what's happened in those hospitals, the ones that have been able to stay open, have often had to go outside the traditional community support that they had and associate with a bigger hospital. That may turn out to have been a good thing. But, you know, one of the basics of the president's health care plan was what we now know is a highly unlikely result where everybody will have coverage. And in a world where everybody has coverage, you don't have the disproportionate share problem that inner city hospitals like the Truman Hospital in Kansas City, Missouri has, or rural hospitals like the dozen plus that we have in our state that are critical needs hospitals. Those things don't happen. You know, if this had worked the way the president thought it would work, and Democrats, when they all on their own passed this bill 7 years ago, if this had worked like they thought it would work, we wouldn't be having the problems we see now, the havoc in our healthcare system, leaving Missourians, people from Alabama, people from Wyoming, people from all over the country with higher costs, with fewer options, and with more uncertainty. You know, how many times did the president say when he was supporting this just after the election and during his election 8 years ago, President Obama said he kept making the case that Americans would be able to keep the plans they like, they'd be able to keep the doctors they like, and now we act as if those pledges really, well, everybody knows that couldn't happen. Well, when the bill was passed, everybody said that was what would happen. It was period. If you remember, it was you'll be able to, if you have the doctor you like, you'll be able to keep the doctor you like, period. If you have an insurance plan you like, you'll be able to keep the insurance plan you like, period. The period should have at least been a question mark. And as it turned out, it was not true. People didn't get to do that. There'd be, according to the advocates of the law we have now, there'd be more choices, there'd be more competition, there'd be lower cost, and none of those things happened. Those things just did not happen. In Missouri, several insurers have totally pulled out of the individual market. We have 115 counties. Last year, they all had at least 2 companies willing to offer insurance. This year, we have 97 counties where only 1 company is willing to offer insurance. I've always thought we needed to expand that insurance marketplace, not reduce it, buying across state lines, buying product that was available, an insurance product that you thought met the needs of you and your family, rather than the needs of somebody at the Department of Health and Human Services that thought they knew what was better for your family than you would know what was better for your family. But instead, we've done just the opposite. Instead of expanded the marketplace and expanding choices, somehow Obamacare was designed in a way that actually, instead of being able to buy across state lines, now you can't buy across county lines. And so we have 97 of our 115 counties where only 1 insurance company is willing to be part of the process on the individual market. That 1 insurance company rightly was able to go and say, here's what we're going to charge. If you don't want to accept that, state insurance regulator, we won't offer the product at all. And so families, 1 year to the next, are often facing 40% increases, and I think the average is 25% increase year over year. Many people are paying more than 100% of double what they paid when this started. The rate hikes have gone up and the coverage has gone down. The average deductible in the bronze plan, the third plan down, the average deductible is $6,000 for an individual and $12,000 for a family, and that's before anybody helps you at all. So you've got insurance that you're paying for every month, but if you get sick, you have to pay $6,000 for each individual, and more than twice that if two people in your family have health care problems before anybody does anything. Now, for most families in our country, and certainly most families in Missouri, that's like not having insurance at all. Even the silver plan, the average deductible is $3,500, and that's an increase of 15% of the deductible over last year. So every year, the price goes up, the deductible goes up. All of us here, from families and from individuals and from businesses who just say we can't continue to do this.